level 2 nursing student with the BSCN program in the MOMAC program. Today I'm going to be doing my subcutaneous and intramuscular injection on Mr. Mario Mancini. Okay, I'm just going to verbalize all the steps involved. Okay, I'm going to prepare both medications. Mr. Mancini, it doesn't say, but I'm assuming he's under 70 kilograms, so I'm going to choose for the intramuscular injection a 22 gauge needle, and for intramuscular I would do a 1-inch needle as well, and this is because that's within the range that's normal. For the subcutaneous injection, I'll be using a 27 gauge needle. It's a range from 27 to 25. 27 is smaller, and that's for patient comfort. I'm going to be using a 1 milliliter syringe for both medications because one is it's been calculated for 1 milliliter for the heparin and 0.5 milliliters for the Halidol, so that's appropriate. We're using the smallest necessary. Okay, so I'm gonna double check that Mr. Mancini's allergies, and also I'm going to see that these are appropriate medicines to be giving him against his medical records. So should we be thinning his blood? Should we be giving him Halidol? So I'll double check that. Okay, so I'm going to go ahead in the medication room and start getting this ready. So I'm going to double check this medication for the expiry date and against the medication order. So I'm going to assume this is heparin, 5,000 milliliters for 1 milliliter vial. Okay, so I'm going to open it up and I'm going to clean it for 5 seconds and wait for it to dry. Okay, so the heparin is the subcutaneous, so I'm going to be using the smaller. I'm going to be using the smaller gauge needle. Okay, and I'm going to be careful to not touch certain areas here. I'm going to attach the needle to the syringe, and it's a lower lock system, so I just twitch and pull. Okay, and I'm going to get that ready for that. Again, I'm going to aspirate this is a 1 milliliter. Okay, I'm going to aspirate a little bit more just because of the pressure involved. Then I'm going to put it in the dry vial. Okay, and then I'm going to not touch the plunger inside. I'm just going to go like that to make sure the pressure, and I'm going to flip it around, and then I'm going to take out 1 milliliter of heparin. I'm going to take a moment to make sure there's no bubbles in my vial, which I'm actually, it doesn't have any bubbles. Isn't that fantastic? And then I'm just going to make sure it's exactly 1 milliliter. Okay, I'm going to put that back down. I'm going to pull it out. I'm going to be very careful. Okay, and I'm going to scoop and put that on. Okay, so this is my subcutaneous injection, and I'm going to indicate that on my label and what it is. Also, going to make sure I'm following throughout this the 8 rights of medication administration. Okay, so this one was the heparin subcutaneous, 5,000 units per 1 milliliter vial, and then the expiry date, okay, and then my initials. Okay, so I've prepared that. Now I'm going to go ahead and prepare the second medication. I'm going to double check it against the MAR. This is 1 milligram Halidol, 1 milligram intramuscular every 4 hours as needed, and it's needed now. 2 milligrams for every 2 milliliter vial, and that works out to 5 milliliters. Okay, I'm gonna take this, just pretend I didn't touch that. I'm gonna go like that. Okay, and this is my intramuscular injection, so it's the bigger needle. Okay, I'm not gonna touch it. I'm gonna take this, I'm gonna engage the lower lock system. I'm gonna go like that. I'm going to aspirate 5, just a little bit more than 5. And then I'm gonna hold this and be careful not to stick myself. Then I'm gonna turn it around. I'm gonna take out my 5. Oh, I had to push it in. Almost forgot that part. Okay, and I'm gonna take out the 5 milliliters. There's no bubbles. Aren't I amazing? But if there were, I'd give it a little tick. Oh wait, there might be a little bubble. Get out of there, little bubble. Yeah, and I'll I'll beat it up until it gets out, okay? Then I'm gonna make sure that I have the 5, I'm gonna adjust. Then I'm going to put it back down. I'm gonna scoop it and make sure that I don't contaminate. Okay, I'm going to take this, find the little end, make sure that I indicate that this is halidol. Okay, halidol. Okay, that's this is 0.5 milliliters. Okay, the expiry date is intermuscular, and it's my initials. Okay, all right. So I have those ready. That's excellent. I'm gonna clean the area, make sure that I put everything away. I'm gonna put the date that I use this, if it's a multi-use, just for the one patient, and put it back in the medication area. Just like that. Okay, now I'm gonna be careful walking around so I don't hurt anybody, and then I'm gonna go to Mr. Mancini. I'm gonna say, hi Mr. Mancini, how are you doing today? This is Tanya Christie. I am a level 2 nursing student with the MOMAC program. I'm just here today to give you some injections. They are heparin and halidol. Have you had them before? Yes, that's great. Do you know what they're for? Okay, yeah, one's a blood thinner, and one's for your mood, I guess. Yeah, you've had it before. And do you have any allergies? Oh, you're allergic to codeine? Oh, I see this here on your chart. All right, I've taken that into account. This shouldn't interact with that whatsoever. So if you don't mind, I'm just gonna go ahead and give you the subcutaneous injection first. And is your stomach area sore or anything? No, you'll let me retract this. I'm going to take a moment and look at your abdomen. Here's your belly button. I'm gonna just palpate around the bottom. Don't wanna go too close, at least 2 inches away under the lower costal mark and above the iliac crest. So I'm gonna take my alcohol swab and indicate where I wet. It's not so wet anymore, but we'll just pretend. I'm gonna let it dry through the air. I'm going to double check this against the MAR one more time. That is the halidol. We don't want to do that. So here is the heparin. Okay. So I'm going to pinch, and I'm going to take that off the cap into the sharps. I'm going to hold it like a dart. And I'm going to just, there you go, Mr. Mancini. Hopefully that didn't hurt. I'm going to go in there, a little quick. Okay. All right, Mr. Mancini, how are you feeling? That's okay. I'm not going to rub it because we don't do that with heparin. Okay. I would have also had another nurse double check this dose before I did this. Okay. No pain. That's great. Let's clean you back up. Throw that out. All right, Mr. Mancini, one more prick and we're done. All right. I would have chosen the abdominal region because this is appropriate for subcutaneous injections. Had that been unsuitable, I would have gone here. All right. Okay, so the next injection, I'm going to be giving halidol, and this medication is indicated to put in the ventral gluteal area, but most intramuscular injections are indicated for the vascus lateralis, but this one is for the ventral gluteal. I'm going to take my non-dominant hand and I'm going to put it on the opposite hip of Mr. Mancini with my finger towards the groin, my upper finger towards the anterior iliac spine, and my middle finger towards the iliac crest, and we're looking for this area here. Okay, so I've landmarked, and now I will take my alcohol swab. I'm going to swab that and wait for it to dry. Okay, as I'm doing this, I'm pulling a little bit so that I'm at least 1 inch away from the place where I was. Okay, so this is a Z pattern injection, and this is to make sure that the medication is not going to come back out after. Okay, so what I'm going to do is I'm going to aim for the middle. I'm not going to get my fingers. I'm going to be very careful. Okay, and I'm going to put that in there. Okay, and then I'm going to steady this. I'm going to slowly, over 10 seconds, inject this into Mr. Mancini. Okay, then I'm going to remove and put in the sharps. I'm going to hold this. All right, hopefully that didn't hurt too much, Mr. Mancini. How are you faring? You're not having any tingling, burning, uncomfortableness? No, we're good. Do you need any Band-Aids? No? All right. Oh my gosh, I should have worn gloves. This is me indicating I should put the gloves on before I gave the injection. Sorry about that. Next time I will. Okay, we'll dispose of the gloves without contaminating them. I'm doffing the gloves, putting them back. All the sharps go in the sharp container. At this point, I would document Mr. Mancini's reaction to the medication. I would come back and make sure that the medications are having the appropriate effect. No idiosyncratic or bad side effects or allergic reactions, and all. That's everything I need to do, I think. Thanks so much. Bye.